Hello everyone. I will just introduce to you who is a periodontist. You would have come across a lot of specialists in medical and dental field. You would have aware of neurologists, cardiologists. In dental specialty also, we have a specialist called as a periodontist, which I would like you all to know. Now, a periodontist is a specialist who is one among the nine specialists and who deals with the subject called as periodontics. Periodontics is a subject or a specialty in dentistry which focuses on diagnosis, treatment, and prevention of the gum disease or periodontal disease, as well as placement and maintenance of implants. These periodontists are the specialists who undergo 3 years of post graduation after their regular bachelor's of dental surgery or their graduation in their traditional schools and colleges, dental school or college. Like other specialists, periodontists are often faced with solving a lot of other serious oral health issues. In addition to eradicating the oral cavity bacteria that causes the gum disease, periodontists are also responsible or can take a charge with the task of restoring the teeth, helping the patient to know or to learn how to maintain their teeth, how to prevent the gum disease, and how to take care of their teeth. Now, the next thing is when to see a periodontist is your question. A periodontal treatment may sort in several ways. Now, your general dentist or a hygienist may recommend a consultation with a periodontist if they find the signs of the gum disease through the course of their checkup or any of their dental care appointment. You may also decide to see a periodontist by yourself without any referral if you feel that you have got some specific symptoms or signs of a gum disease. So, in fact, as I said you before, if you experience the following symptoms like red gums, puffy swollen gums, gums that bleed easily, which can be through brushing, post brushing, flossing, or maybe chewing, tender sore gums, reddish gums, you may see ulcerations on gums, pain when chewing, sensitivity of teeth, bad breath, all these conditions, please encourage yourself, in fact, to schedule an appointment without any delay, either to your general dentist who will give you a referral to a periodontist or directly to a periodontist. Now, what can a periodontist do for you? How can he help you? He can do a non-surgical gum disease treatment, which is your regular scaling. He can do a surgical treatment. Maybe you all have heard about something called as a flap surgery or a gum surgery. He can do a laser assisted treatment for gums, which can be again non-surgical and surgical. He can do gum grafting, bone grafting if there is bone loss because of the gum disease. What happens in later stages that the bone gets compromised. So you can place an artificial bone. Dental implant placement, dental maintenance, implant related treatments. Sometimes implant gets mobile, implants get infected. That also a periodontist can treat. Smile makeovers he can do, and gum bleaching, which is a cosmetic procedure called as depigmentation. So not only a periodontist can help you with treatment to save the teeth, also for cosmetics, which is aesthetic, and also for implants. Now the next thing is how to find the best periodontist. You need to know the credentials of the specialist whom you are going to approach, the longevity or the length of the practice the periodontist has already been into, the continuing education, whether what type of dentist is he academically, professionally, clinically, what type of background data you know about the specialist, which you can get nowadays everything from Google. Treatment philosophy, try to know the treatment philosophy of the specialist, whether they have following the old school of thoughts or are they only traditional treatment is done or any advanced procedures are done. Does your periodontist do laser? Does your periodontist does laser assisted treatments or maybe a microsurgical treatment or cosmetic treatment? All that, whether the periodontist is what type of the uh, nature of periodontist or a specialist, in fact, you are trying to look for, whether the periodontist is very friendly, sober enough, try to listen to your problems, or periodontist is standoffish nature, totally cold and nervous, then does they have a pain management options, because you may undergo procedures, surgical procedures, not only during your periodontal diagnosis and evaluation and during treatment also. It is slightly painful treatment, so you need to understand the pain management options, whether they have payment options, whether you're getting an options of payment and the cost is and the treatment cost is cost effective or too expensive, or any other modes of payment are allowed, whether you're going for insurance or third party payment, or whatever the options are. Last and not the least, the location. It has to be in a very good vicinity to your residence. Very easy for you to go around to the doctor whenever necessary. In case of emergency, suddenly you may get bleeding after the surgery. Suddenly you may get a lot of pain after surgery, swelling. So you can rush to it. You know, half of the time you waste nowadays traveling, or your commuting becomes an issue. So you need to take all these into considerations. There are multiple places, multiple multi-specialty hospitals where you get specialists. Try and know the specialist, try and know what exactly you want from him or her, and try and know what are the options. Is he very clear and vivid with the options he is addressing to your problems or no? And then you can choose your periodontist and undergo the treatment. This is what is the evaluation strategy. Any periodontist will make you lie on a dental chair and evaluate using a probe. It's a small instrument which this instrument will be inserted all along your gums to check the pocketing, to check the bleeding of the gums. So this is a slightly uncomfortable procedure, but then it can be managed by the periodontist. So this is what you'll be mentally prepared of can happen to you. Okay. So gum disease, examination, management, treatment, everything has to be taken care by the periodontist, and periodontists are the specialists who will guide you, which is what is the right toothpaste for you, right mouthwash for you, how to do flossing, how to do brushing, and all these details can be taken from the periodontist. Thank you.